imagine qualifying for health insurance, but never getting it. Not because health doesn't exist, but because the system is confusing, fragmented, and intimidating. Right now in the US, 8.7 million non-citizen immigrants are uninsured. A 2025 Kaiser Family Foundation in New York and LA Times survey shows that lawfully present immigrants remain uninsured at triple the rate of naturalized citizens, a reported 21 versus 7%. Not because of cost alone, but because of barriers like confusing applications, fear of interacting with government programs, state-specific restrictions, and lack of clear guidance.
That's why we built ClearClaim. At ClearClaim, we translate complexity into clarity. We simplify insurance access into one quick, easy-to-fill-out form that eliminates guesswork, reduces anxiety, and shows people exactly what coverage they qualify for before they ever touch government paperwork.
Even immigrants who are legally eligible for insurance often never enroll. This problem affects us all. When people can't access preventive care or emergency rooms become overloaded, healthcare costs rise, and entire communities become more vulnerable.
Today's market is a red ocean. Government portals are hard to navigate. NGOs and legal aid groups provide support, but they're fragmented and slow. Enrollment platforms like healthcare.gov and Health Sherpa focus on selling policies or enrolling users, often earning commission, which leads to commission bias. Everyone is competing downstream, fighting over enrollment numbers and plan sales. No one owns the space upstream, where people simply want clarity.
ClearClaim doesn't compete inside the enrollment system. We sit on top of it. We focus on pre-enrollment clarity, helping people understand eligibility before paperwork, before sales, and before stress. We don't sell insurance. We don't take commission. Instead, we create a new market centered on neutrality, trust, and accessibility. That's our blue ocean. Compared to today's industry, ClearClaim dramatically raises information clarity, eligibility ease, speed of access, digital reach, and personalization, while keeping price free and reducing complexity. Instead of competing on enrollment value, we compete on clarity.
Here's how we created value innovation. We eliminate commission bias and conflicts of interest in coverage recommendations. We reduce industry jargon, fear from complex government forms, and confusion about insurance requirements. We raise accessibility for immigrants, transparency, and trust. Finally, we create simple, easy-to-fill-out forms and clear guidance before enrollment.
We target three groups traditional systems overlook. First, lawfully present immigrants who qualify but never enroll because language barriers, fear of government systems, and confusing eligibility rules prevent them from completing applications. Second, nonprofits, schools, churches, and employers with large immigrant workforces who want to help but lack scalable tools to provide accurate insurance guidance. Third, non-immigrants who face literacy challenges or system fatigue and feel overwhelmed by bureaucratic processes even when support systems exist. ClearClaim turns these non-customers into empowered users by meeting them at the point of confusion, not after.
We've already built a working prototype website and eligibility form that guides users through insurance qualification in under 2 minutes. Behind the scenes, we programmed a rules-based eligibility engine that evaluates user inputs, including immigration status, income range, household size, and employment, and dynamically calculates which programs they qualify for, such as ACA marketplace plans, premium tax credits, Medicaid, and CHIP. But distribution is everything. That's why we're lining up partnerships with organizations that already serve immigrant communities. We're targeting national immigrant advocacy groups like United We Dream, legal aid organizations such as RACES and Catholic Charities, federally qualified health centers, community health clinics, and large employers in construction and hospitality industries where immigrant workers are concentrated.
These organizations already help immigrants navigate housing, legal status, and employment, but they struggle to provide clear, scalable insurance guidance. ClearClaim becomes their plug-and-play digital front door.
Millions of people qualify for healthcare, but never receive it. ClearClaim closes that gap, not by selling plans, not by replacing government systems, but by translating complexity into clarity. Clear guidance, ClearClaim. Thank you.